So we have a couple of very exciting panelists today. Ramin Bastani, founder and CEO of Hula. Sorry, Tom Lee, chief executive of One Medical Group. And Jesse Slade Shantz is to my right. He's the CMO of OMsignal. And then closing us off, we have Doug Hirsch, co-founder and CEO of GoodRx. And I think we're going to start with a little demo from OMsignal.
Right.
So let's kick it off.
I'll do that, please. Good afternoon, everybody. I have a riddle for you this afternoon. Everybody knows that wearable is the new mobile. Wearable is the new black. I've seen many people around here wearing the Jawbone Up, the Fitbit, the Nike Fuel Band. So I guess my question to you is, which type of wearable have we, all of us, been wearing our entire life? Any takers? Any guess? It is clothing, our clothes. And that's what OMsignal is about. It's about turning our clothes into connected devices which help us live a fitter, healthier, happier life. Let me sort of give you a glimpse of that future here.
What if life became a little smarter simply by putting on a shirt? What if being connected meant really being in touch? What if what we wore helped us get through life a bit more smoothly? Or be healthier, fitter? Imagine if our clothes helped us take better care of our loved ones. Or on demand provided that crucial medical information. Or maybe brought us together in magical moments we simply could not have before. Well, OMsignal is making it possible.
And let me try now and make it a little concrete for you guys, and forgive me, but stripping is part of the demo. What I'm wearing here is an OMsignal shirt. I own many of them. I wear them at the gym, at the office, at my son's hockey games. There's no glued or patched electrodes. The shirt itself is the sensor, and OMsignal delivers what we call the ABC of wellness, and we'll show you on my iPhone what we're seeing live here. It's always available to me on a continuous basis. We get activity, movement. We also get, that's A for activity. We get B for breathing. Watch the blue circles here. All of this is live. And breathing is an important signal because it's automatic, but it's the only signal that you can manually override, go into yourself, impact your autonomic system, which in turn impacts how you experience life in general. And C is for cardiac. Of course, from our cardiac signal, we get heart rate. Mine's a little elevated right now because I'm speaking in public. And we also get mood, the relative tension level. Mine is fairly focused at this stage. We also capture life moments. If one of our biometrics goes up, then it takes a picture from the inside. So for example, it said that I was stressed for 10 minutes on the 28th of October, and I could go back to it and understand the context that created that stress in me. We also have live ECG. That is my live ECG, which I get on a continuous basis. And you might be asking yourself, can I share all this information with my trainer, with my doctor, or with my close relatives? And the answer is yes, if you desire to do that. What you are, and if we could go to the other screen, please, the PC. What you're looking at here are the live biometrics of my team. Most of them are in Montreal at the other end of the continent. And we are here, Jesse and I actually. Jesse, stop breathing. Check, stop breathing. Breathe again. It's all live information here. If we go back to the slides, Jesse. So ultimately, what we have is a platform, and our aim is to enable the crowdsourcing of health. Just imagine millions of people biostreaming their physiological data into the cloud as they go about their everyday lives. And this can only be achieved through clothing, a very ubiquitous form factor. And this information never existed in the history of mankind. That's just a fact. And we think this will allow the, let's go to the next slide, new use cases. Right now, our users are using it for fitness, to manage their chronic condition, or to help get information to manage their chronic condition. Next slide. But over time, what we're hoping to do is to predict, to tell you, go to sleep early tonight, or you're going to have a cold. Or stop right now, you're at risk of having a heart attack, or go hard at the gym because your HRV and your breathing is aligned for a big workout. So that's how we hope to help users lead a healthier, fitter, happier life. Thank you for your attention.
Awesome, you guys. That was really interesting. Whilst we wait for, we have one more demo that actually spawns nicely out of this. What do you guys think? Have you guys any initial thoughts, impressions?
I think it's
feelings?
awesome, and I think there's a good mashup with our company. How do you figure out how people, when they have sex, if they keep their clothes on, how does that work? Yeah, ask Fitbit about that. They had a little bit of an issue with that in their early days, so that's maybe a risk rather than a like good feature to add in there. I was partly kidding, but thank you.
All right. Next up, we have another demo, this one from Nirajani, and they have this wonderful product that I've actually been lucky enough to see a couple times at a number of conferences over the past year, and it just seems to be more and more buzz about you guys, and it involves breathing. So take it away.
All right, I'm so happy to be here with you. So as we know that breathing well helps us to be more healthy, it helps us to be more present. It really helps everything that we do, from improving our sports and fitness to our sleep. So about 20 years ago, I took a real deeper dive into breathing because I had a very serious, debilitating illness. And medical science couldn't help me, alternative practitioners couldn't help me. And then I found this woman who was 85 years old from Germany, and she said she thought I could get well. What she taught me was a lot of techniques about deeply sensing my body and breathing. And so I practiced for about 4 hours a day, and over time, I got better, and I got active just like I am here today. So as soon as I got better, I spent the next 15 years researching what was it about what I was doing, what was it about breathing that helped me to get well, so I could share it with others. And that's really the genesis of this app that I'm going to show you today. So the app's called My Breath, and it's free, and it works with just a regular headset. But today, for this setting, I'm using a special headset because it works better. And just with the regular headset, you just take the mic and you put it underneath your nose, and you're ready to go. So what you're going to see today is you're going to see my breathing pattern. You'll see like a little waveform for my inhale and another little waveform for my exhale. Meanwhile, I'm hearing it, but you won't be able to hear it. So let me show you that. And I'm going to record it too. Now, for some people, just hearing their breathing for like a minute or two, and some for seeing it, is enough to help them get into a really healthy pattern of breathing that really stays with them for the day. But In addition, we have a lot of data, and I'm just waiting for the internet here. And as soon as the internet comes through, I'll be able to show you the score. And I don't know if we're going to have internet service here today. So I'm going to tell you about it. So what we have when the internet is working is we've got a breathing index score, and we score you from 0 to 100 and tell you where you are from refreshed, optimal, to light stress, to, you're going to get to see mine. Okay. Here we are, 89, that's not bad. So there's my breathing index score, refreshed. And I got a reward. We've got lots of rewards in our app, and they're real rewards because we want to reward people for being healthy and breathing. And so this score is based on the 7 most important metrics for optimal breathing at rest, which are your rate, how fast or slow. And we've got all the information for you underneath each one. Depth, tension level is respiratory tension, any kind of wheezing, nasal wheezing, chest wheezing, how smooth or choppy, variable, apnea. And then we actually give you a whole picture with detailed information for those of you that really like that kind of data. Now, you can share this. You can email it to a healthcare practitioner, a coach, a friend, if you like. And for those of you who like Facebook and Twitter, it's an option. And we're also connected with Aetna's CarePass platform, so you can sync your data with Aetna's CarePass. So other features of the app that we have is I've put some coaching tracks in here, and these 2 tracks here are the most important things that I found after working with thousands of people in helping them with their breathing that would help them in just a few minutes. We've got many, many other features in this application, and we've got a table and a booth right over in the exhibition hall. So I hope you come and see us. But before I go, I want to give you a sneak preview. And if I can turn the iPad. Okay. So we are going into the wearables market, but not the shirt market. We're going into wearable accessories and have designed this headset. It's a retractable headset that has all the acoustics, all that information that you just saw, plus it will have optic sensors for your heart rate. And we're doing research right now looking about how all those qualities that I showed you about breathing change as we exercise, and also as we rest and sleep. So, all right. So you can purchase our app in the iTunes store, and I thank you.
Thank you so much. That was really terrific.
Great.
And I found that sort of intoxicating. As soon as I saw the image, I started breathing more slowly. And, so yeah, thoughts and feedback on this one. What did you guys think? Have you guys been thinking about breathing stuff lately?
I tried it out actually, and it was interesting to see how you change the way you're breathing when you're watching how it looks on a screen. So
yeah.
I think in terms of mentorship and how to address a problem that you have, it's a really interesting concept because we don't get that when we go home from a hospital basically.
Yeah, no, and I think that one of the things that can be so confusing for people, and that might be a good jumping off point for this panel, is we go to the gym and we do yoga and we go to all these places where we're told how we should be doing things, but when you're not with another person sort of saying, oh, you're doing it right now, you're doing it wrong now, or correct a little bit this way, when we're at home, it can be a little bit challenging to sort of maintain the practice and to find sort of like a coach for yourself a lot of the time. And it seems like apps like this in particular, they provide sort of gentle guidance and train you over a longer period of time, and that seems very useful. So on that note, let's talk about everything that you guys are doing, and I thought that perhaps a good starting point would just be to sort of go down the row and talk a little bit about each of your companies and why you started them and what intersections you see between them and personalized medicine. So Ramin, do you want to kick us off?
Hi, I'm Ramin Bastani. I'm founder of this company called Hula, and we help people get laid. That's the best way to actually say it. And we verify your HIV and STD status, and then that you share with a significant other or on an online dating site in a verified way. So.
And I should also add that Ramin was recently named by Fast Company.
We'll give you laid if you have questions a little bit.
He is the safest man to have sex with in America. That's right? Right? That's what they said?
Yes.
You can look it up. All right, Tom?
Hi, I'm Tom. I run a company called One Medical. We're redesigning the primary care model and making it more personalized and effective at delivering higher quality care. And we've built a model that's scalable across the country and in multiple markets, including coming to LA shortly.
All right. Doug?
Hi, my name is Doug Hirsch. I'm the co-founder and CEO of a company called GoodRx, which is focused on bringing price transparency to prescription drugs.
All right.
And then I'm Jesse Slate-Shantz, and you just saw what I'm involved with. But I'm an orthopedic surgeon, and I joined OMsignal because I think that there are a lot of problems with the patient-physician relationship and communication, and I see what we're doing as a way to really enhance that and take it to the next level.
And maybe since we have a personalization theme, and also because I've had the opportunity to talk to all of you a little bit about this at one point or another, what caused you to want to be involved in this space? Why did you start your companies? I think that you all and each have such interesting stories as far as that goes.
A girl slapped me in the face when I asked her if she'd been tested. And that's the reason I started the company. Seriously.
Same for me. It's a little bit of a longer story, but the short story is I was a physician in training and saw how bad the system was and thought that there were enough people complaining about it and somebody should probably try to work on solving the problem, so it's led to this path and journey.
I think for me it was personal experience. I think a lot of companies in health are born on someone's suffering or someone's inability to get something done. And in my case, it was just not being able to have control of my prescription drug costs and not realizing, or most Americans have no idea how much they're overpaying for their prescription drugs.
And I was talking to lots of patients with shoulder pain, and I understand that they have problems with sleep, and they just can't get to sleep or they get woken up. And I realized that I can't really quantify that, but suddenly with some of the available technologies, I can hope to do that and maybe figure out if the treatments that I give people are going to actually improve their sleep, which is one of the main things that people want to get better. So I called Stefan, and here I am.
All right. And so far, I think that another theme that comes up amongst all of your companies, obviously, is patient empowerment and having control of your own story. And so far, and you guys don't have to go in order, just jump in and interrupt each other. I feel like good conversations have interruptions. What have you seen so far? What sorts of feedback have you gotten, and what would you like to be seeing from what you're doing?
I think what's frustrating oftentimes is we have these great technologies and ideas, but it can be very, very difficult to actually get people to use them. And I can't tell you how many, if you're a Health 2.0 veteran like I am, how many companies have come through where they're claiming they're going to do something amazing. You just have to do this, that, and the other thing 20 times a day.
Yeah.
And nobody really does that. And so I think, hopefully we're getting smarter as literally technology and health are merging, where the same usage patterns you're finding on a photo sharing app or on Uber or something like that are being brought to health in a way that actually is consumer friendly. Because I think to date, it's just been a really frustrating sector because technologies are chasing consumers who don't necessarily see the value or don't have the time. Mm-hmm. And so it's encouraging to see this sort of merger of, I'd say companies understanding true human behavior more.
Mm-hmm.
Well, that was going to be my question to these guys is, they're building kind of applications that allow for interactivity with consumers and between consumers. And I've found that the experience is very limited, right? People aren't engaged, and you can talk all you want about, your health your way. I don't think people care as much, and they're not interacting. So I'm kind of curious, what kind of interactivity you guys are seeing, and what is the motivation that creates that? Because, fear or, getting laid? Or,
Ours is actually incentive. It's a good question. Yeah, so I'm with you, Doug. I see a lot of companies that kind of talk about all these great things that people are going to supposedly want. Ours is one of the strongest motivators there is. People want to have sex, right? There's 50 million people who date online. And what we do as a company is we actually make STD testing suck less, right? We help you figure out the best places to go in the country, and we've curated our own database to help you figure it out, kind of like Yelp for STD testing. locations. We help you get your records online, which has been a big problem about the patient empowerment. We make it within a couple clicks and a swipe of your iPhone, and you can actually get a request sent to your healthcare provider, including One Medical, who's been incredible at responding within a day or two of the medical records coming in. The third thing we do is we let you unzip safely, we say, and on your iPhone app you have a zipper that dangles, and you have to unzip it in order to share your profile with someone else. We want to make that conversation just a little bit less awkward and funny and even flirtatious. And the last thing we do is we actually remind you when you get tested again. And people are using it on dating sites. People tell us stories about how they're using it in person. And we just partnered with one of the biggest gay dating apps there is in the country.
What I like though about OMsignal as an example, and I have no relationship to you guys, just watching it, is that like I imagine it's actually working for you right now, and that to me is a sign of a successful app. You don't have to do anything; you're just wearing the shirt. I think the breathing app's interesting. I don't know if I'd wear that when I'm sleeping. I mean, that's an honest question I would throw out there. And so, I just ask yourself all the time, like, is this something that I would put up with? It's great to do it once or twice. It's great if you work at the company. But could you actually see a real consumer doing this every day of their life?
Mm-hmm. So my experience with that is I've worn it for 4 months now, almost daily. And it's something I wear in the operating room. I wear it with my family. I wear it when I'm doing breathing exercises. And it allows me to really figure out what things kind of stress me out. It allowed me to figure out things that relax me in the operating room, like teaching somebody who's much more junior than me versus things that are really very stressful, like trying to walk somebody through a procedure who's almost at my same level and who wants to do a lot, and so I have to give them give them some control of the situation. So it's passively there, so you can look back on things. You've got all the data. You don't have to be mindful of like collecting it. You can be mindful of looking back on the data.
That reminds me of something that you said to me actually about that since you guys have launched your app, your users are getting tested more and more because you see the dates on the tests and other people see the dates on the tests. And so you start to see these subtle nudges to make large behavior change, and then those play out on a large scale population, which is really exciting. And maybe that's I'm going to jump ahead a little bit just because I'm there, and then we'll go back to some other things. But it made me think about big data and sort of the role of that. And I think that can be something that people obviously feel nervous about because it's what's going to happen to my information. But then there's a lot of really exciting applications as well for the sorts of information that you're gathering just from a public health perspective too. What you're learning. So you want to take that one?
I think, let me ask a question to the audience. How many people here have like a preferred card for some store or for an airline or anything like that, or like a points card? So most people do, and the whole idea of those is that they collect your data constantly and that they're paying you to collect that data. So I think people are pretty comfortable with that concept of giving up like what they do on a day-to-day basis. Yeah. And so, I think this is just kind of an extension of that. And we, as the developers of these technologies, have kind of a responsibility to people to really protect that data at the same level that a hospital would do that in the end. And so I think that like on those two fronts, we can probably address that and get by it and actually get all that data so we can start predicting. Like Stefan talked about in the demo, really like understand what's the trigger for something, understand what biometrics are predictive of you developing a cold, or if you're heading towards a heart attack, or if you're too tired. And we can only do that if we have access to the data. So we just have to be really careful.
Yeah.
I'm kind of curious about your product. Do you guys store every single data point for all your users?
Yes.
Yeah. Got it. And you've run the math on the cost of that, and it's going to bear out? Because, I know the cost of data is getting really cheap, but sometimes I feel like we've got too much data, and there need to be reasonable hypotheses about which data you're going to use to figure out what behavioral change. Do you guys have a focus on what you're drilling down on and what you're capturing explicitly?
Yeah, so we're trying to become really focused on some of the things. Right now it's more getting the technology on people to manage the actual collection of data, because you need to have a variety of data in order to figure out trends. So that's going to be the first step. And then in the future, I think that it's completely scalable. You can see that people would want to add on to our platform, and then they'll end up analyzing a lot of the data. So
how many people are using your wearables, and then what kind of attrition do you see over time?
So we're just in the testing phase, so we only have a small group of people. We're planning on launching after Christmas for all the people doing New Year's resolutions to track what they're doing. So and then after that, we'll have a lot more users in the market.
All right, well, here's a question that I've been dying to ask is sort of the role of community. And with all of these things that you're doing, it seems as though there's a big component of just how and where people connect, whether it's online. I think a lot of these have opportunities to sort of help yourself change your behavior through sort of connecting with other people who are doing what you're doing, and then certainly also taking that story that you're forming and finding people in your real life who you can sort of share that with. And what have you noticed about that, about users and users coming together, and how that aspect of things has helped people use your product or yeah?
Our users come together for sure, and it's specifically, it's almost, I mean, they actually come together. What we're doing is viral. It's not the best way of saying it, but it's pretty viral. And so in one way, we're an antivirus, right? That's one way of thinking about what we do. But we actually have people using this as a modern flirtatious version of I'll show you mine if you show me yours. So when you say community, for us, it's very individual.
Yeah.
Or we've also heard about sex parties, where the only way you can get in is if you show your status, and it has to be within a couple, like 2 months, and you have to have been tested for certain things. So we're seeing it used in a variety of ways we never could have possibly imagined.
Yeah.
But we just want to help people make better decisions.
Yeah.
And we don't call it healthcare. We want to make it more fun, because it's the only way to have a conversation about STDs, right? Or one of the ways. Stefan's another way of having them.
All right, Tom, what about you with One Medical? I mean, that's a brand that's we're starting to see around, and I would feel as though if I were a member, and this has happened to me, where somebody will tell me that they have joined One Medical, and there's a certain amount of pride that it's like your gym. How does that play into your doctor experience?
Yeah, I mean, I think we look at health as a very local phenomenon, so we're really focused on building local care experiences, and we think that community is a part of it. So that's why we're participating in these type of events as well. We want to interact with the health and lifestyle community in addition to the traditional doctor community. So I personally think that the community is a much more powerful form for behavioral change than data itself. Data is an enabler, but the community cohesion is really what drives long-term health and kind of behavioral change from my perspective. So we're trying to foster that at One Medical, both in a physical and in a virtual sense, but it's still early. Yeah.
And Jesse, we're going to get back to you, Doug, but you said something that sort of dovetails off of that really nicely about how people, when you see a device, when you see someone wearing a Fitbit, it's just this instant conversation opener where, all of a sudden then you'll start talking about what it is that you're doing to, what your workout is like and how the experience has been for you. And you sort of feel emboldened in your choice to be doing this, and it probably reifies your decision day in and day out to stick with it until it's a habit.
I grew up in the country, and so if two people driving Jeeps pass each other, they'll normally give each other a thumbs up or whatever when they're passing. And that's really the way the wearables market for some of these more overt wearables is becoming, where you see somebody and you end up showing a perfect stranger your sleep patterns and talking about how you use the device. And I think that's something that's really a part of this. Is it's actually a visible community. So it's not like Facebook, where I don't know how many of you are members of Facebook, but I would know if you were wearing it up that you're a tracker, and then I could have a conversation with you about that, and we would have that immediate connection. And that's interesting because it really brings people together with technology, on a very sort of person-to-person basis and face-to-face basis, which is totally different than most other technologies. And I think that's maybe one of the things we're not appreciating that's going to bring this movement into fruition, make it a big thing, is that people are going to just like that interaction with each other.
Yeah.
So.
Doug, is there any way with your app, I know it's a little bit different, but in terms of just finding, I guess, perhaps patient communities that are looking for specific drug deals, or someone who has HIV, for example.
Yeah, I think it may be more than that too. My last company was focused solely on patient communities, and I've worked at Facebook and Yahoo, so I'm pretty familiar with that kind of stuff. I think what I see more of is just consumers realizing they have to play an active role in their healthcare. I mean, you look back 10 years or something, and I knew I had health insurance, and I didn't really care what else happened. If I had a problem, I asked my friend where to go, and that was about the extent of community. Right. And now I think, for better or worse, we are being forced to play an active role in all of our healthcare decision making. And whether it be just knowledge, whether it be cost, whether it be monitoring our own health, and so I think slowly but surely consumers are being dragged into a world where they have to just be so much more active and present in their own healthcare.
Yeah.
And I think that's going to ultimately work to our benefit.
Yeah.
So do you think you can simplify it somehow, like put a pressure to simplify that a bit through what you're doing?
I mean, in our case, we're just solely focusing on cost, right? And again, it wasn't long ago where people had insurance and they thought, I have insurance, I don't have to worry about anything. And now you can play that role, but you're going to pay 20 times more than you should pay if you just bother to pay attention, And so I think the same thing with medical care as well. And so, you'll have, I see sort of two classes. You'll have sort of active healthcare consumers who actually understand how to play the game and know how to do research just like they do for every other aspect of their life. And then you'll have folks who don't, and unfortunately I think they literally will pay the price for that. So.
There's another component to all of this, obviously, which is the provider side. And how are providers responding to the companies that you're involved in, and how can you perhaps also sort of nudge them sort of to be active participants as well?
For us, they either love us or hate us, right? Some of them hate that they're getting 30 or 40 faxes from our users that are their patients saying, give us our records.
Yeah.
So some of them hate it. Other ones love it and are using it as a way to not have to actually call or have the patient come back in for a second visit just to tell them they're negative. So we're partnering with providers to actually help them get the results into their users' Hula record, their personal health record.
This was something really interesting about Hula, is that they have sort of a rating system about how fast the providers get the records back or get the results back. And I think that's, to your point about the Ubers and the rating apps and the sort of real world other apps that we use. I love it when there's something that works so well outside of healthcare and we're finally starting to see, people understand what this is, how this works. And and it seems to be really driving some change, right?
Yeah, absolutely.
Yeah.
Healthcare providers know that if you request your records from them, they have a certain amount of time to respond. And you can actually decide where you want to go based on how long it takes for them to give you your records back. And if you're getting tested for things that are not fun, like STDs, you want to get them back as soon as possible, right?
And for the record, I heard that One Medical had a good score.
Yeah, One Medical has been incredible. It really has.
That's great.
Yay.
Good team.
What about the rest of you with providers? Maybe also with the drugs, the pharmacies, and
Yeah. We have tremendous positive response from doctors who ultimately want consumers to take their meds, and if we help people take their meds, that's a great thing.
Right.
I think in the world of pharmacy, it's an overused word, but we literally are disrupting that space because it's, there was a lot of time where a lot of pharmacists could charge a lot of money for something that didn't cost them very much, and for better or worse, they're being called to the carpet and being incentivized to be honest. And so I think lots of pharmacists have been very positive. We've had pharmacies approach us about wanting to participate, and others have to look in the mirror and say, what are we going to do here? Because we're now living in a transparent world where people are going to know what we're up to. So
Yeah. Alistair. I think the other patient-provider question that I certainly have is, I have a Fitbit or I have a shirt and I have all this data and I go to my doctor. What are some ways that I can use that data to help my doctoring experience and sort of create some kind of a bridge between those two? Because I feel like often right now what we see is people kind of doing their thing with their healthcare and then they go to their doctor and it's a completely separate experience. It's sort of what are some pieces of advice that you could perhaps give audience members too about how to have the conversation that you're doing? You're using a monitoring device or you're looking for drug deals at a certain, that's perhaps an easier conversation with your physician and getting your physician on board and creating sort of a shared story that you could work on together in the 11 minutes or whatever it is now that the doctor-patient encounter is.
Well, I'll just throw in, because I'm not the doctor here, but one thing that I see that's frustrating is I feel like if you look back like 5 or 10 years ago, consumers did not have enough information. Now it seems like it's almost the reverse. Consumers have too much information. You're talking about where are you going to store all the OMsignal data, right? And so I feel like when I see people who have serious health problems, their heads are spinning because you do a search on the internet and you get 9,000 things you can do and 9,000 opinions. And I would say one of the bigger challenges we all face now is just too much information and how to actually turn it into a group of trusted sources and figure out the right path. And I'd say for doctors too, if I showed up in your office and said, here's all my OMsignal, here's my 9 other apps, here's 9 paragraphs worth of stuff, how are you going to divine all that in 20 minutes?
Yeah.
I think today you have to be an active user and you have to really learn how to integrate these things into your life and how to analyze the data for yourself and talk to your physician about it. I think what we're going to see in the future, near future, is the ability of the app to actually have a physician-facing portal that can actually show the physician what they need to see in terms of your biometrics. And then, future, I can see the end of the pill,
Yeah.
I could see it being that the physician prescribes the app, to lower your stress at certain times, to improve your blood pressure, because that's the first step before you go on to try to treat hypertension.
Right.
Or, an app that diagnoses your arrhythmia, and they prescribe you that app because they know they use a biometric device. So, it might be the end of pills for most people.
Yeah. Tommy, you're going to say something as well?
Yeah, I was going to see if I can overwhelm the speakers next door. But yeah, I think this is a challenge. Is most doctors today barely have time to take care of really critical, basic healthcare issues, no less any other quantified self-data. So I think that's a challenge if you want to engage with the healthcare system with the other data that you have, and I do think it's a problem. I do think that there are solutions that are going to be coming, right? Physician groups like ourselves that can allocate more time to the visit, but are also thinking about programmatic design and more kind of systematic group design where data and groups and cohorts can work on a topic together and kind of use that as a focal point for engagement. I think those are more viable solutions because I think the doctor's office visit already has too much crammed in it, and it's really not an effective forum for this type of dialogue. And so again, community data and kind of a trusted authority I think are the ingredients, but it's still TBD, I think.
I know that this is more relevant for some of you than others, but cost transparency. Are you starting to see movement with that at all? And with what, particularly Doug, with what you're doing?
I think you are seeing it, whether it's by choice or by force from your insurers and other folks that participate in your healthcare. We've chosen to do prescription drugs because we think the switching cost of going to pharmacy A versus pharmacy B is not that big of a deal. There are other great companies like Brighter is a company here in Santa Monica as well that's doing it for dentistry. I know the One Medical guys are kind of poking at this as well. It's clearly coming. It's coming because companies are going to cut back on the benefits they're going to provide by insurance. Uninsured Americans now need to know what they're going to do, or until they follow the ACA and actually get insurance. And it's the reality of where we're going, for better or worse. And so I'm really curious to see how it extends into other categories. Again, tests, labs, primary care, hospitalization. We've chosen our little war to fight, but maybe you guys can talk more about the medical side.
Yeah.
Yeah, I think these are all kind of different components that are coming together, so I think we're looking at all of them and looking to partner with folks to create those ecosystems.
We're certainly working on that because everyone believes STD testing should be free or it is free, but when they get to the clinic they realize all of a sudden they're trying to charge you $150 for a test, and you're like, forget this, and you walk out. And I've actually seen that happen in person to teenagers. So we want to absolutely bring transparency, whether someone's offering free services or they cost money, almost like a kayak model, but not as thorough at this point.
Yeah. All right, you guys. Well, we have 10 minutes to open up the floor for audience questions, and also, because there's a small group, if you guys have questions for each other, ask them too. So yeah. Anybody? Yes. I think we have a mic right there too.
Awesome. Thanks a lot, guys. I got a question about how you guys see the future of doctor visits with a lot of the big data that you guys, or the data that we're aggregating. How is that going to affect, if you say 20 years in the future or 10 years, where do you see a typical doctor visit going?
I guess this is me. Yeah. That's a long horizon. I think the short answer is I think there are going to be changes outside of the doctor's office that are going to influence the doctor's visit more than the doctor's offices themselves. I do think that a lot of it's going to be virtualized and through video conferencing technology and other equivalents. The payment model is going to be dramatically different as well. So I think the reality is that my sense is the factors for alignment of change are better than ever, and I wouldn't be surprised if they're dramatically different 10 years from now, and more thoughtful and relevant to what people need. But there's a lot of structural changes that need to happen first.
I've been in the business for 8 years, and there's been no change really in the doctor's visit then, except for that we're entering the same data we wrote in charts into computers, and it's the exact same system. And I think it's going to take a major shakeup to break doctors from their habits, and it's going to take probably people pushing it at the doctor rather than doctors pulling it from people. And what I'd like to see is that you don't need to go to the doctor anymore unless there's a problem. Like, why have a well visit? Because we're going to be able to know when things are happening. We're going to be able to track things better than we can now with your yearly physical, history and physical. So hopefully in 10 years, you're just getting a call from your doctor saying, hey, we need to have a chat, and then figuring that out, or even being shunted to the right specialist, not going through the runaround of, like, for me, it'd be somebody who's gone to see their primary care, gone to see a rheumatologist, maybe gone to see a rehabilitation doctor, physical therapist, and then come to me with a problem that needed surgery right away. And that's a waste. It's a complete waste of time for you, for those practitioners who are busy already. And so we should expect that hopefully we can get people to the right spot at the right time with all the data we're going to have.
Thanks. This is a question more for Dr. Lee, but I remember in training too, trying to explain, spending 15, 20 minutes in medical training, why people didn't need a test based on some data that they'd come with. And so, I guess the long-term, we have a long-term vision, but as far as, like, I guess what's happening now, how does it work now? Are you having patients come in with bringing in a lot of their data, and the physicians having to go through it, or is that?
Yeah, I mean, that is a challenge. The healthcare system doesn't pay us any differently for counseling on a lot more volume of data. We're a service-oriented company, so we're trying to address those needs in the current constructs, but there's a lot coming into our offices that we try to manage. Fortunately, we've got more time per visit, so we allocate a lot more time so that patients can actually have a dialogue with their physician or provider, but it's still very early. The reality is that we're designing systems now that will move the dialogue into more of a shared virtual setting where this dialogue doesn't need to be repeated in every single office and exam room. So the question is, how do you abstract this and bring this out into the public digital sphere and allow people to engage and add their own lens to it? So that's kind of our bias, is a lot of this information and knowledge should be kind of facilitated outside the exam room, but today it's least common denominator. People are used to that habit, they're used to the insurance, the copay, the doctor office visit. So we deal with that construct today.
Gotcha. Are insurers letting you, when you spend that extra time though, are you able to, like, increase the complexity, or?
No, the way we've made the model work economically, we're still fee for service predominantly, but we've lowered our overhead by 2/3 just to kind of manage the office more efficiently, and so that we invest more time per visit, which is unusual, but that allows, the key ingredient that's missing out of the patient-doctor relationship is time. And face time to start, and then virtual time in the future. Yeah.
That's an interesting question, because I'm Canadian, and I trained for 2 years in the U.S. as well, so I've experienced both systems, and I spent a lot more time here explaining that, because I think there's a sense of value in getting more service. But if you're in, let's say, a managed care setting here, where your premiums may change by the number of people who get an unnecessary test, then you start to think about things a different way, and that's sort of like the Canadian mantra. Like, if I get this test, which is not going to change my treatment, then it's an extra cost to the system. And I think it kind of gets culturally ingrained, so that may change with managed care increasing here and accountable care organizations.
Hello, friends. I'm friends with most of you up there. My name's Jane, and I love what you all do, because you make it easier for healthcare people to be consumers, and whether you agree with that term or not, that's what we are. So this question is actually for Doug, because I use GoodRx and I love it, because what you've done is you've put many apps together in one, and you've streamlined it where I don't have to use the GPS and the couponing from the pharma and other things, so, or WebMD for whatever reason. So who's using GoodRx? Is it uninsured people? Is it older people? Is it chronically ill people? I mean, what's the demographic of your users today, and is that different than where you want to go?
Thanks for asking, and good to see you. When we first built GoodRx, it was totally on the premise of uninsured Americans. And again, I didn't have much knowledge. I just figured some people might not get the benefit of insurance. As it turns out, I was totally wrong. I would say our sweet spot is we tend to skew slightly female, because women tend to be the medical officers of the family. And then I'd say sort of in the 30 to 65 range is our sweet spot. Medicare often has better coverage, although we still can often beat Medicare prices, and we actually have Medicare copays on GoodRx. But I'll give myself as an example. I got pink eye this summer. I walked into Rite Aid. I used my existing insurance. It was $14 for Maxitrol eye drops. I then looked at GoodRx. It was $9 if I just paid cash. So, you know, we're actually now actively trying to say to people, you know, because a lot of people look at us, they go, that's great. They pat me on the head and they say, I don't need what you have. I have insurance. Well, trust me, you do. And just one last example. If you look at Covered California, the bronze plans in Covered California actually have a $6,000 drug deductible. So all these people and all ACA and all the press we're seeing, all these people are going to sign up and they're going to have zero coverage, at least on the drug side, until they for the entire year, really, unless you have a serious illness. So we're seeing a lot of use by insured patients as well.
So you have to educate people how to use high deductible health plans and HSAs, because that's where you're really helpful.
And that's where the world's going. So
right.
for all of us here.
For all of you, yeah.
Agreed.
Right, thank you.
I think we have time for one more, yeah?
This is never working. Okay. Okay, for Tom. We see more and more technologies that enable patients to do all kind of testing or even first treatments at home, like for cholesterol or even STDs. Do you see that as a threat to One Medical, or is it something that there might even be a convergence between your offices and your patients' homes?
Yeah, I mean, I think most of it's frankly a compliment. I mean, I think more data for the consumer and as they're more engaged with their health is a good thing. It doesn't need to be brokered through us to the extent that we can be helpful in a dialogue. That's kind of our model. So one year might be STDs, it might be cancer another. It'll vary, but that doesn't bother us at all, and we're happy to engage with all people who are engaged with their health. Yeah.
Is One Medical doing anything like that already? Where they say, don't need to come in the office, we'll send you something.
Oh yeah, we're not dependent on office visits. We are agnostic to how people come in. In fact, we do a lot of virtual visits today that are not paid for by insurance, that are just in the patient's best interest. Our goal is to offer quality, affordable health care. So to the extent that people don't need to consume expensive, provider resources to do very basic, simple things on their own, or in the context of a facilitated interaction, we're fine offering that. Yeah.
Awesome. Well, thank you guys. This was really interesting, and I hope to follow all of you and out the door right now. So let's go. Oh wait, we have one last thing. We have some lays in case anyone wants to get laid here. You can say you got laid at a health panel. I'll get laid. There we go. Super easy.